We are all such busy people, but I'm so excited. We have another individual, a special guest, two special guests coming in actually, and we're very excited. Wendy Longwell is the Disability Action Center program manager, and Wendy's actually coming in from out of state as well. So she is going to be joined by a community member, Barbara Hickey. And they're both going to just follow up with this summary that we received from IHSS with Karen Kiesler. Now, Wendy, I'm going to just pretty much let you take the platform. So if you have your camera, please go ahead and turn that on. And then if you require anything from me in intercession through this, please just give me a holler. I'm right here to facilitate. But I want you to engage your story and also to freely engage with Barbara since she doesn't really know me. So please take it away.
Okay, well, you have my camera turned off, so I cannot turn on the camera.
Hold on, we'll get that right back to you.
There we go. So hi, everybody. I'm in Idaho visiting my dad, and my son has in-home supportive services as well as home at HCBS hours as well. And the difficulty is still there that they were talking about as far as finding workers to cover. You may have the hours, but you don't have the workers to cover all the hours. So that issue, as far as I can see, is not going away anytime soon. It's something that we get phone calls at the office quite frequently about, as far as not being able to provide providers for people that need it. And where with my son and for Barbara as well, they're both lucky because my son has me and Barbara has her husband, Brian, that can step in and help. But then there's those people that don't have that family that lives close enough that can step in. And so that's where our biggest concern is being able to access the services that are there when you need them. And it's becoming more and more difficult to access a lot of services that are supposedly there to help people, but then actually being able to access them and use them when you need them is the challenge. And you know, with Medi-Cal being divided up throughout the state of California, so if your company that is managing the Medi-Cal in your area, so for us in Shasta County, it's partnership. In Butte County, it is a two-plan model, and so forth and so on. As you go throughout California, you hit different entities that are managing Medi-Cal. And so if you have a specialist that you need to see, and that specialist isn't in the county that your Medi-Cal provider manages, it can be difficult to access that professional. So for me, it was getting my son down to Stanford. Partnership does not have a contract with Stanford, and so the only reason why we were even able to access the specialists down there, which he has 3, was due to that his dad had him on his private insurance through his work. And so we are considered what's a special member and can go pretty much where we want. But that still doesn't mean that other entities such as Stanford Hospital is going to be willing to take on the client because they don't have that contract with Medi-Cal in your area. So it has become increasingly difficult for people who have Medi-Cal to be able to access who they need. I've helped several people who were in situations similar to Barbara, who were homeless and needing specialty care, such as oncology, and couldn't access and get treatment because of their homeless situation, and the specialist they needed was not in the same area as the Medi-Cal managed care. And so I've helped several people that try to access the services that they need and get the help that they need when they need it. And I don't know, I know Barbara's not feeling well today. She just got back from having surgery at UC Davis last week. So I'm not sure if Barbara's on or if it's Brian.
That's me.
Hi, Brian.
Hi, Wendy.
So do you want to share a little bit of your story about how you first came in contact with me when you were when Barbara had just gotten diagnosed?
Yeah. I've been working for a guy for 28 years. Found out that I had to have surgery.
Brian, I'm going to interrupt for just a second.
Yes.
We're getting a huge audio glitch. So when you first started, you came in nice and clear.
Okay.
So if you're moving around, you're going to be like a statue for us to keep your signal.
Okay. Anyway, I worked for a guy for 28 years. He found out that I couldn't work. I was living in one of his rentals. And they put us out on the street. Seven months we were out. Then we found out Barbara had cancer. We had been moving our camp, and I hurt my ankles and was given medicine for acne on my back that I couldn't be in the sun. I heard about the Disability Action Center through social services. Came in and met with them, and within a week we were in a place, in a motel.
Brian, please take your time. We know this is difficult to share, so please take your time, okay?
I'm trying.
No problem. Just take your time.
We'd also found out that Barbara had stage 4 cancer. She went through chemo for 7 months. She's done with that. She's had her surgery. She's cancer free now, but she has an open wound that's about 14 inches long. As a matter of fact, we're going down to Davis to see her doctor now for a recheck. She's going to have to be where she can't be going anywhere for 8 to 10 weeks. And we have, luckily, our Medi-Cal covers for MTM medical transport to bring us down there and back because we don't have a vehicle. Disability Action Center donated a wheelchair for us, which is awesome. And had that put on my insurance, so the insurance would cover any costs on that. So, yeah, she will have to do a couple of rounds of chemo again for maybe more for prevention. And but we got hooked up with Project Roomkey, and Katie, and they've been taking care of us. But that program ends on the 30th, so we're basically back out on the street. We've tried to get into Tibra, but we cannot get Barbara's Social Security card because the Social Security office is closed. We're going to try to make an appointment and see if we get down there. But again, she's not supposed to be out and about. And I'm kind of stuck because I'm her caregiver right now. But Disability Action Center, we would have both been pretty much screwed without them. I call them our angels. They basically saved our lives.
So Brian and Barbara we've become very close to both of them. When she first got diagnosed with stage 4 lung cancer, the doctor
colon and liver.
Colon, sorry.
Yeah.
I got that. My dad just got diagnosed with lung cancer. Sorry,
yeah.
Getting people mixed up. When she got diagnosed with the colon cancer, the doctors were refusing to treat her because she was homeless. And so we were able to get them immediately into a hotel and then connect them to Project Roomkey. We are now trying to connect them to a medical respite program so that they can stay in the hotel while Barbara heals, and we continue to try to find permanent housing for them. It's very difficult in our community because we've had those big fires up here and we are in a major house shortage. And so it makes it very difficult to find affordable housing. And we've been working on this throughout her whole treatment, and we through the programs we've connected them with, they think they have somebody that's going to a place that'll work out for them, and then it ends up falling through for one reason or another. So their story is ongoing. She's healing up from her latest surgery, but yet again, we still don't have a home for them to be in. And like I said, without having a stable place, nobody will treat Barbara in her condition. And it's very sad that we make choices on who we will treat based on their home life situation. You know, when it was outside of their control of losing their home, yet they are also losing their ability to keep Barbara healthy. And so we have been, sorry, I'm at my dad's house and I don't know where his phone is, it's ringing.
It's okay, Wendy, don't worry, keep going.
Okay, so we worked together and got Barbara her ID.
Looks like that phone took her signal right with it.
Yeah,
Hang in there, Brian.
we are. We are.
Brian, while we're waiting for Wendy to come back in, I want to just share a thought with you that came from some of our attendees, because one of the comments that was made earlier was regarding the fact that it's really challenging to have provider availability. So what were your thoughts when you had to go so far?
I've got rheumatoid and osteoarthritis going through my whole body. I've had one knee replaced. I have to have both of my shoulders replaced. I've had to put my surgery off so I can take care of my wife. They would combined for both of us in our condition, they would give us like 7 hours a week is all we could get for home care. I have to give her medicines basically 24 hours a day, every 2 or 3 hours. I have to give her shots in the morning for Lexicon. I have to help her go to the bathroom, which is very difficult for me. But we've been together for been married for 28 years. And we can't live without each other. So yes,
and you shouldn't be required to make that level of a choice of separating from each other, to be honest.
I know. And if home care was a little more readily available, I mean, we signed up for it and they told us what they do, but we're in a motel. I can do I've been doing cooking and cleaning that I can. And Barbara was able to help some, but with her chemo, she got to the point where she couldn't get out of bed. I put off my surgeries until she's healed. And I have to go into surgery on the 30th of September for my right shoulder, and that's an outpatient. I'll be operated on and put back to wherever it is we are the same day. Then after my physical therapy, which she has to do physical therapy also for a year. After my physical therapy, I can go have the other shoulder replaced and then be sent home immediately after surgery.
Thank you for sharing that. Thank you very much. Wendy, I see you're back in now, so. Oh, did we lose her again? Oh, no, I see you.
Yeah.
We see you. Yeah, thanks, Wendy.
Would you quit playing hide and seek, Wendy?
I keep losing connection for some reason. So yeah, I mean, so I didn't hear everything that Brian said, but you know, he needs to have surgery as well. And so based on both his and Barbara's condition, we're limited in Shasta County as far as finding a downstairs apartment, that there's no stairs.
So Wendy, I'm going to have you turn your video off. That may keep your audio going.
And also, just to throw this in, since I've had my wheelchair is now a permanent fixture for me for medical, and it's on my insurance, I have to be able to be in a place where I can keep it. And
Absolutely.
Tibra or HUD would only allow us 1 bedroom. Like we have to have a 2-bedroom. She has a problem with incontinence, and we get 4 boxes a month of supplies for her. We also have to be able to store those. And we can't put it in like 1 bedroom. That would not be feasible for us. You know, we thought we had a 2-bedroom, but that fell through. The TBRA program doesn't allow us to be in Reading city limits. We would have to be in the outskirts, which isn't really feasible for either one of us because our doctors are either here in town in Reading, or some of hers are in Davis even. And
absolutely. So Brian, I want to give you an opportunity to share with our attendees today, you know, your experience is the real deal. You saw the positive side of services that are available, and you saw the challenging side of services that are available. So if you could speak from the heart as to what you believe is the most required element for care, just speaking from your own situation, what would you like to share with us today?
in our situation, it would be relevant to have more hours for in-home care allowed, but because we're not completely we can't get that. She is at this point because she can't lift anything right now. She has an open wound, and she has a wound vac. She has to lay down most of the time. And me, I can do a lot, but I have arthritis in my back, rheumatoid and osteo, and it really kills me. But plus, she's my life, like, and I would do anything for her.
Thank you, Brian.
But a few more hours of help would help. We have a nurse that comes in 3 times a week to change her wound vac and clean her wound, and basically that's it. That's the help that we get right now.
Thank you.
I'm doing everything else for us.
I want to share with you, Brian, that we have a comment from Sarah, one of our attendees, and Sarah is voicing, thank you for sharing your stories, Brian and Barbara. It's very eye-opening on how our systems are working and not working. So we do thank you. And well, Wendy, I know you've had a passion. Go ahead, sir, go ahead.
We have found that since all of this, there is a lot of angels out there.
Absolutely, yes. And I think what you've been able to speak with over the last few minutes is an audience of angels. Just know with all heart that your story is reaching many. And Wendy, you are one of them. Oh, we appreciate it. We appreciate it. Wendy, we know you as well have had a passion.
Wendy is definitely.
Absolutely. Go ahead, Brian. We couldn't hear that.
I said, and definitely ain't. Wendy is an angel.
Oh,
and so is
you.
Carrie. The whole staff there.
Yeah, it's a good agency and good people. Wendy, I know you also, in your own life situation as well, have just displayed a passion for advocating for adequate and accessible health care for anyone who is in a challenging situation or who has a disability. Can you please give us your closing comments here on this segment and why you chose to bring in Brian and Barbara. I see your,
There.
yeah,
Now I'm
there
unmuted.
you go. Now you're unmuted.
So this is an ongoing issue with multiple of our clients that come into Disability Action Center and that are ongoing. And whether they're homeless or not, they can't get the workers even though they have some hours. There's just and that's really the sad thing. But I asked Barbara and Brian to be on just because they have tried so hard to access the services, and we're just hitting brick walls until we stepped in and started getting them connected. And it just shouldn't be that hard for people to access the services that are out there, that they have to come to us to get those services. I'm happy to help them, but it shouldn't have to be that difficult. And we care very much about Brian and Barbara. They've become part of the DAC family, and we will be with them until they can get safely in their own apartment and get through their surgeries. So
Thank you, Wendy. We appreciate that. We've lost your audio on this side. So we just want to give a heartfelt thanks to you, Wendy, for encouraging Brian and Barbara to come forward. Brian and Barbara, there are no words to express how much we appreciate you sharing your story. You are a living example of what you see on that screen in front of you, which is reaching for that higher community aim, reaching for transformation of the conditions in which people are living or that they're born into. So that whole life process, optimal health, optimal care, mental, physical well-being at every stage of living. You see, this is the wind up of what the master plan for aging is meant to be about. So lots of resources for information. We will send out a follow-up email to all of our participants and registrants today so that you understand where some of these resources have come from, and you can add them to your toolbox to share with the community in whatever capacity you are able. Again, thank you, Brian and Barbara. Thank you, Wendy. We deeply appreciate you coming in today.